Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Is it safe to eat vitamin K-rich foods while you're on a blood thinner? In fact, can you take your multivitamin if it has some vitamin K in it while you're on a blood thinner? The answer is yes, absolutely. Eat those vegetables, eat that fruit, take that multivitamin and get healthy. But there's one exception. Warfarin, also known as Coumadin. We'll talk about this later. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the Chief Scientific Officer over here at Invite Health. Welcome to our episode, Vitamin K and Blood Thinners. First, a quick overview on vitamin K. What is it? What is it used for? Vitamin K is a fatty-soluble vitamin. You have to take it with food for it to be absorbed. And evidence shows that many Americans are low in vitamin K. This is because of our lifestyle, our eating habits, our diet. And you need two forms, by the way, vitamin K1 and vitamin K2, but we'll talk about this later. So what is vitamin K needed for? Strong bones. So let's go through a scenario of bone building. I'll take you kind of from start to finish. Collagen is the framework for your bone. Tens of thousands of highly organized, tough, stringy, elastic cables of type 1 collagen. So that's the foundation, that's the framework for your bone. Now you have to get the calcium in there. So to absorb calcium from your food or your supplements, you need active forms of vitamin D. What activates vitamin D? Well, it's activated typically in the kidneys through the mineral magnesium. So magnesium is required, vitamin D is required. And you're absorbing the calcium. Now the calcium has to be shoved into the bone. That's where vitamin K comes in. So this is a second need for vitamin K. Vitamin K helps create the receptor sites for calcium on the organic matrix, the foundation of the bone that's made out of collagen. And you need vitamin K to take the calcium out of your blood and shove it into the bone. How does it do it? Vitamin K activates a proteinaceous enzyme called osteocalcin. We call that carboxylation. And then the osteocalcin grabs the calcium and brings it into the bone and shoves it into the bone. There are other enzymes that depend on vitamin K to be activated that are involved with this, but osteocalcin is the best known. So it's kind of like a crane. The crane is lifting calcium out of the blood and putting it in the bone. Vitamin K would be the crane operator. But then there's a second enzyme, proteinaceous enzyme, that's also as equally as important. It's called matrix GLA protein. So what's that all about? Well, that also is vitamin K dependent. That's the thing that grabs the calcium in the bloodstream and brings it over to the bone. So you have a handoff there. You have matrix GLA protein picking up the calcium out of the bloodstream, bringing it over to the bone, handing it off to osteocalcin that strongly shoves it into the bone, firmly shoves it into the bone to build good, strong bone crystals. Matrix GLA protein helps prevent soft tissue calcification. That's important. When you're inflamed, it attracts the free calcium that's in your blood. So you don't want a buildup of calcium in soft tissues like the milk ducts of the breasts, or the prostate, or the brain, or the blood vessels in the heart. And one of the ways that cardiologists, heart doctors, measure how dangerous the plaque in your blood vessels are is by the amount of calcium in the plaque. So is calcium a bad guy? No, scientists believe that the calcium is in there to stabilize the plaque, but it's a bad sign because it means you have a lot of inflamed plaque. So even though the calcium is not the bad guy, it's a proxy that you're in trouble. So it's the matrix GLA protein that grabs the calcium away from the blood vessels in the heart and away from the breast and away from other tissues and brings it to the bone. And you need vitamin D to activate the matrix GLA protein. So that's two really, really important activities right there. Now, what does the vitamin K do in the bone? Well, it's activating the osteocalcin. That's grabbing the calcium away out of the blood. And that osteocalcin allows you to create calcium hydroxyapatite crystals, which is most of your bone. Calcium hydroxyapatite crystals is how calcium exists in your bone. So you need vitamin K to build bone, and you need vitamin K for clean arteries. Now, there's also evidence that vitamin K is important for the brain. It seems to do some kind of dance with vitamin D. These two nutrients often interact together to build bone, to keep the heart healthy, to protect blood vessel walls, and also for brain health. And there's evidence that if you lack vitamin K and you have some kind of negative function of the brain, that damage to the brain with age can accelerate if you're lacking vitamin K and vitamin D. So what about blood clotting? See, that's the confusing part of vitamin K. Vitamin K is a gatekeeper for blood clotting. It helps prevent you from bleeding to death if you have a wound, if you get cut, or you're having surgery. But at the same time, it helps prevent a blood clot that can lead to a stroke or a heart attack. So that's not well known about vitamin K, and it needs to be well known. Because of the blood thinner Coumadin and vitamin K smacks into Coumadin, everybody thinks that vitamin K is a blood thickener. It's not. It's a regulator. So vitamin K prevents bleeding after a cut. So vitamin K is essential for water-soluble clotting factors to activate blood clotting, like blood clotting factor 2 and blood clotting factor 7 and factor 9 and factor 10, as well as protein Z. So what's protein Z? You never hear about that. It's a member of the coagulation cascade. Coagulation means creating a clot. So these are a group of blood proteins that lead to the formation of blood clots. So that's vitamin K dependent. So what about preventing blood clots? What? Preventing blood clots with vitamin K? Vitamin K is an essential factor to activate protein S and protein C. People who lack protein S and protein C, they're likely to develop dangerous blood clots. Protein S and protein C work together to help prevent improper clotting, such as in a pulmonary embolism, a blood clot in the lungs, or deep vein thrombosis, a blood clot down near your groin, or a stroke or a heart attack. So protein C is a major anticoagulant. It's natural to the human body. It's naturally circulating throughout our body. It's vitamin K dependent. So you need vitamin K to keep protein C active, because you don't want a stroke or a heart attack. Now, this activated form, along with the protein S, degrades clotting factors. And there's a quantitative aspect to this and a qualitative aspect. In other words, you need enough of it, that's quantitative, and it has to work well, that's qualitative, to protect you from blood clots. So if you lack either protein C or protein S genetically, or because you lack vitamin K, it can lead to thrombophilia, a tendency to develop thrombosis, blood clots. So what's protein S? Well, that's also vitamin K dependent. It's a glycoprotein in your plasma, the liquid part of your blood. It's made in the liver. In us humans, it's best characterized, the function of protein S, its role in anticoagulation pathways. It's a cofactor for protein C. In other words, protein C prevents improper blood clots, or if a wound healed, you have to get rid of the old clot. You need protein C for that. It will not work without protein S, and protein S will not work without vitamin K. So there's 3 types of vitamin K. There's the synthetic one that they sell as a prescription. Doesn't seem to work so well for certain activities, such as building bone. And then there's vitamin K1 and vitamin K2. Now, vitamin K is always fatty soluble. You need to take it with food if you're taking a supplement so you absorb it. So vitamin K1 is called phyloquinone. It's also called phytonadione. So there's 2 names for it. It's found in green leafy vegetables like broccoli and kale and Brussels sprouts and spinach and lettuce and broccoli rabe and chicory root, but also in asparagus and green beans and some vegetable oils like soy oil. Most of the vitamin K in our American diet is K1. Most of it, almost all of it. Because K2 is more like in fermented foods. You could get it in meat. You get a little bit in like a steak or a chicken leg, piece of chicken. Vitamin K2 is called menaquinone, and there's a whole bunch of different varieties of it. It's found in fermented dairy products like yogurt and kefir. Kefir is like a fermented milk. Or cheeses like Emmental cheese. And fermented soy foods that they don't really eat in America unless you go to a Japanese restaurant frequently and you're really into it, like tempeh and miso and natto. Now, we make a little bit of K2 in our intestines. It's the healthy bacteria that make it out of vegetables. Now, vitamin K2 may be especially helpful in increasing bone mineral density, making your bones thicker and stronger, and reducing the risk of fractures. So those with osteoporosis, severe bone loss, severe demineralization of the bones, or osteopenia, which is similar but a lower grade, should consider supplementing with vitamin K and perhaps with more focus on vitamin K2. Now, the absorption rate of vitamin K1 from a supplement is approximately 80%. I say this with a reason, because the absorption from food is significantly lower. So even if a food has a lot of vitamin K1, you don't absorb it that well. You absorb it better from oils than from vegetables. So if you have vegetables with like olive oil on it, that's the best way to get your K1 out of it, because the olive oil is a fat. It improves the absorption of the vitamin K1 from the vegetables. Vitamin K2 is better absorbed from foods. Now, up front, I asked you, is it safe to eat vitamin K-rich foods or take a multivitamin with some vitamin K in it while on a blood thinner? The answer is yes, absolutely. Eat it, take it, get healthy, with the one exception, warfarin. The trade name is Coumadin. It started out in the 1940s as rat poison because the rats bled to death, and then they realized, hey, there's some utility here for us humans. We could prevent blood clots. So in the 1950s, the FDA allowed it as a drug. So how does it work? Well, it's an anticoagulant. It works on vitamin K-dependent clotting factors. So where is it used? Well, it's not really used for arteries. Arteries are big blood vessels. That's where your blood pressure is. That's the blood vessels leading away from your lungs and heart, bringing oxygen to your legs and your muscles and your brain and your organs and systems. But then the blood has to go back to the heart and lungs. It has to pick up more oxygen and be pumped around the body again. This happens 80 times a minute typically. The veins that are returning the oxygen depleted blood to the lungs and heart, they're a lot narrower than your arteries. So because of the way Coumadin works, they normally use it for veins. And we'll get into that in a minute. So there's basically two types of blood thinners. Those that work on platelets. Platelets are the cells in your blood. They look like plates, and they start the clotting process. They're very important for clotting. So antiplatelets include aspirin, like the low-dose aspirin, or Plavix, which is clopidogrel, or Effient, or Brilinta. Those all work on platelets. They have nothing to do with vitamin K. And then there's the anticoagulants. These lower your blood's ability to clot by stopping specific specific clotting factors. So if you could stop the clotting factors, you keep the blood thin. Now, they're really not blood thinners. That's really a misnomer. It just gives you an idea what they do. One works on platelets. One group works on platelets like aspirin. The other group works on clotting factors. So clots can occur in your veins or arteries. So, like I said, the veins are smaller, and the blood clots in the veins are typically deep vein thrombosis that you get near your groin down in your legs. And that can shoot up to your heart and be pumped into your lungs, which can be life-threatening. That's called a pulmonary embolism. So they use Coumadin for that because it works better in the smaller blood vessels called veins, but also the arteries in the heart. It's used in the arteries of the heart. Why? Because the arteries inside your heart that supply the heart with blood are much smaller than the arteries in the rest of your body. They're more like those sippy straws you have in those kids' drinks. So if they start to stiffen and thicken, it's really dangerous. So Coumadin, that's the trade name, warfarin, it's used to treat blood clots that form in the veins, the smaller arteries of the heart, such as deep vein thrombosis, pulmonary embolism, but also to prevent stroke in people with atrial fibrillation, because once again, we're talking about smaller arteries in the heart, diseases of valves in the heart, artificial heart valves. Now, a common side effect to Coumadin, warfarin, is bleeding. I mean, it could cause brain bleeds. It's kind of scary because out of all the blood thinners, it's the one that most commonly causes bleeding in the brain. But it can also cause tissue damage. And I'll tell you something else. When you're on Coumadin, it works on soluble clotting factors. These are the ones that vitamin K activates. So if you have too much vitamin K, you negate the effects of Coumadin. So because of that, and because people are eating different foods all the time, and vitamin K is found all over the palate, it's found all over your food. You take all different kinds of food, and there's vitamin K in so many of them. Because of that, they have to check your blood clotting like every several weeks. It's a pain in the neck to keep Coumadin in that sweet spot that prevents you from clotting, but yet doesn't cause bleeding. So they look at something called the INR, the International Normalization Ratio. And they want it between 2 or 3. Below 2, your blood's too thick. Above 3, too thin. So you have to keep on getting checkups to see if the Coumadin's in the right spot. And that's a pain in the neck because you'd have to eat the same amount of... Let's say you like broccoli, and you know that broccoli helps lower the risk of certain diseases like certain cancers, right? So there's good evidence on that. So you want to eat your broccoli every day. You'd have to eat the same exact amount of broccoli every day. Otherwise, if you stop eating it, the Coumadin becomes too strong, or if you eat more, the Coumadin becomes too weak. So people don't want to put up with that. So they came out with a whole bunch of new drugs where vitamin K is not an issue. So many things interact with Coumadin. Anything else that thins the blood, like aspirin, Advil, Aleve, or the herb ginkgo biloba, or vitamin E over 400 units a day, or nattokinase. You get that in fermented foods called natto. So it's very complicated dosing warfarin, and it does interact with vitamin K. But I'll tell you something. If your vitamin K is too low, they'll never be able to stabilize your dosage of Coumadin. You need some vitamin K if you're on Coumadin. However, vitamin K is probably needed for the brain. There's pretty good evidence for that. It's definitely needed for your bones, and it's definitely needed to protect the breasts and the heart and the kidneys, any place where calcified plaque can build up. So you don't want to be without vitamin K. Let me give you an idea of what happened in a mouse study. It was the University of Maastricht over in the Netherlands. They wanted to cause calcified plaque, calcified coronary heart disease in lab animals and mice. So what did they do? They took vitamin K out of their food, so the mouse chow had no vitamin K, and they gave them Coumadin. Within 2 weeks, they developed calcified plaque in the arteries of their heart. So what happened then? Well, they reintroduced vitamin K, and they took them off Coumadin, and they got rid of the calcified plaque in the heart. I mean, that's crazy. And so many things have vitamin K. Green leafy vegetables, parsley, cilantro, dill, all the cruciferous vegetables, the broccoli rabe, the bok choy, the cabbage, the broccoli, the Brussels sprouts, all of those. Leafy greens in general. Certain cereals, certain fruits. I mean, it's just unavoidable if you want to eat a healthy diet. So they found out that Coumadin was involved with osteoporosis. Now they're scratching their head. Why would Coumadin be involved with osteoporosis? Because you can't have enough vitamin K, you dummies. No, I'm serious. If you go into like PubMed and you type in Coumadin and osteoporosis, they'll say, well, we don't know why Coumadin causes osteoporosis. Because you can't have enough vitamin K to keep your bones strong. It's very simple. It's very straightforward. So there was an initial report years ago that warfarin could reduce bone mineral density. So then they found studies linking warfarin, Coumadin, to fractures. So a 1999 study, we're going back down memory lane, almost 600 women taking warfarin for deep vein thrombosis. Now that's a valid use for it. The risk of vertebral fracture, that's in the spine, and rib fracture was increased. Not really other fractures, it was more spinal fractures. So there was a 2006 retrospective study of a large number of women. Long-term use of oral anticoagulants and the risk of fracture. It's in the Archives of Internal Medicine. It was 15,000 Medicare recipients. Warfarin use for more than 1 year, a 60% increased risk of osteoporosis-related fracture in men. They thought that it was a combination of a reduced intake of vitamin K and issues with the drug itself. So what about other blood thinners? Not a problem, like Pradaxid, that is dabigatran. Doesn't mean that they're totally scot-free safe. Dabigatran and Pradaxid interacts with a lot of drugs. I'll do another podcast looking at blood thinners and interactions. Like there's a lot of evidence that certain blood thinners interact with your statin drugs like atorvastatin and simvastatin and become dangerous. So Pradaxid is an anticoagulant, but it has nothing to do with vitamin K. And they use it to prevent blood clots that lead to a stroke, like in people with atrial fibrillation. Atrial fibrillation is when the top chambers of the heart are quivering very rapidly, and they're not efficiently pumping out blood. Blood cells are getting left behind in the upper chambers of the heart, and they could shoot out and cause a stroke. It's the second most common cause of a stroke after high blood pressure. So they also use Pradaxid in people who've had like knee replacement or hip replacement, and in people with a prior history of blood clots. It's used as an alternative to Coumadin, the warfarin, because it doesn't need all that monitoring because it doesn't interact with vitamin K. So there you go. Now there's another one, Eliquis, which is basically my favorite. It's Apizaban, but the trade name is Eliquis. And it's used to prevent blood clots, to prevent strokes. It's used in people with atrial fibrillation to prevent strokes. It's also used after hip or knee replacement surgery. Bear that in mind. So it's a replacement for warfarin because it doesn't need all that monitoring. And why is that important? If you have a joint replacement surgery, it inflames those surrounding tissues and it can throw off a blood clot. Just like having a broken hip can throw off a blood clot. So after you have that kind of surgery, you need to be on a blood thinner for a certain amount of time. And here's the problem. The orthopedic surgeon is going to hand off your case to your primary care physician, and they may not interact enough, they may not communicate properly, and the ball could be dropped on taking your blood thinner, and you're at risk of a blood clot after knee replacement or hip replacement surgery. So you have to take it for a month, several months after it, depending on the patient. Now there's Lixiana. It's also known as Savasa. Once again, not a problem with vitamin K. Not a problem. Then there's Xarelto. That's a great one. Xarelto's another good one. I think my favorite blood thinners, if I had to take one, Eliquis and Xarelto. And the last one is Brilinta. Now that works only on platelets. That's the only pill you could swallow that works on platelets, which are clotting cells. There are some natural blood thinners. Exercise and a good diet's a nice way to start. Don't smoke. Treat your diabetes, get your cholesterol under control, get inflammation in the heart under control with things like krill oil. Natural blood thinners, the problem is they don't have enough research that doctors would know how to use them. There's more research on the synthetic blood thinners, the drug prescription blood thinners. But natural blood thinners would be nattokinase. It comes out of the fermented food from Japan called natto. It's a fermented soy food, nattokinase. Another one, and it works on a broad spectrum of blood clotting factors. Another one would be ginkgo biloba. But once again, I wouldn't trust that one as a blood thinner. I'd rather use nattokinase. High dose vitamin E does have a blood thinning effect. What about garlic? Well, aged garlic would be a very poor blood thinner. That's why it's pretty safe to give when other people are on a lot of drugs. But fresh garlic has some blood thinning activity. So how do I feel about me? Well, my blood pressure is like 110/70. My bad cholesterol is 89. My triglycerides are in a good place. They're about 130. I exercise. I eat a really healthy diet. Um, I'm kind of comfortable. I'm taking enough supplements every day that I don't think there's the kind of inflammation I'd have in my arteries that would trigger a blood clot. So I'm fine with the small amount of vitamin E in my multivitamin, and I'm fine with the aged garlic I take, and the tocotrienols I take every day, and the resveratrol I take every day to keep things moving smoothly. If I got COVID-19, I would add nattokinase because I probably would not get that sick in the first place. But the nattokinase gently helps prevent blood clotting, and one of the nasty parts of COVID-19 is blood clotting. So thank you for listening to the Invite Health episode of Vitamin K and Blood Thinners. You can find all of our episodes for our podcast wherever you listen, you name it, wherever you go for your podcast, or just go to invitehealth.com, our cover page, and scroll down, and you'll see this big icon for podcast. And we have several hundred plus podcast episodes on there now. Please subscribe. Please leave me a review. I'd like to know how I'm doing. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you another time on another episode of the Invite Health Podcast. Thank you for listening.